It has been 3 years now since COVID-19 first started plaguing nations around the world. The virus forcing strict lockdowns, businesses have closed, overwhelming hospital systems, and it has killed millions worldwide. The pandemic has left many wondering how to best respond to a health emergency like this one. According to a new report from Trust for America's Health, less than half of the states are considered highly prepared for a public health emergency. Dara Liberman joining us this morning. She is the Director of Government Relations for Trust for America's Health. We're going to be talking about how Michigan falls in that new report. Good morning.
Good morning. Thank you for having me.
Of course, let's get right to it. What's Michigan looking like?
Well, we look at states across 10 indicators, and unfortunately, Michigan fell into our lower tier this year after being in the middle last year. There are areas where other states improved over the past couple of years, where unfortunately Michigan did not, just in these data points that we look at.
So in general, what is needed to protect the public's health during an emergency, and how can Michigan improve?
Well, overall, nationally, we recommend sustaining our investment in public health. Unfortunately, we went into this pandemic with a chronically underfunded public health system, with way understaffed, with under-resourced, using archaic technologies. And that's just not a great way to detect and respond to a new threat. Specifically in Michigan, we recommend that they join what's called emergency management accreditation. It's an important way to measure how they're doing against national standards. And we also, they also need to, all states need to improve their vaccination rates against seasonal flu. And we also recommend joining a nurse licensure compact to make it easier to bring nurses across state lines.
How do health inadequacies affect emergency preparedness?
Well, when we underfund public health, it means that we're asking them to go into these crises with not enough people. In some cases, health departments were responding to the pandemic using fax machines instead of modern technologies that we would really need to fight these modern threats. We also need modern communication systems. We know that public health and healthcare are battling misinformation and disinformation, and it's really hurting our ability to inform the public with accurate information.
It feels like there's so much here that we can really improve on, but how? How do we get more funding? Because there's already a lack of funding in so many different sectors of our government.
True. We recommend investing in basically the base of the pyramid here, the foundations of public health. We really haven't invested in the people, in our public health infrastructure. Essentially, we are building firehouses after the fire has already started burning. So investing in modern data systems, in people, those are really where we need to start in making sure that we're ready for the next major event.
Any key policy recommendations that you would recommend Michigan leaders take a look at?
Well, certainly, yeah. We all states should look at, for example, paid leave, making sure that people could take time off if they're sick. That's a great way to stop infection so people don't get their coworkers sick or their customers sick. So many people just have to make that choice between going to work when they're sick or getting the paycheck. So it's really important. That's an important policy states could take. And also just improving state public health budgets. Unfortunately, we didn't get Michigan's data this year on public health funding, which is one of the important data points that we look at. So sustaining that funding year to year in the state budgets as well.
Is there anywhere where people can go to read this report?
Yeah, our website is tfah.org, and all the information's there.
All right, Dara Liberman with Trust for America's Health. Thank you so much for being here with us this morning and kind of laying out some things that people need to know.
I appreciate it. Thank you.